all down the broken road. I call on you to help me carry the load. Oh Lord, you never let me down.
Thank you for joining us today. Anything you hear in this podcast is not to be taken for medical advice. This podcast is for information purposes only, and should you find something interesting in the information spoken about, please consult your physician further.
Hello, and welcome to the Broken Road Podcast. I'm your host, Trent Peterson. Today, I'm joined by Amanda Renfro. She was my physical therapist at the Neuro program that I went to, and she did dry needling on me. And we're going to talk a little bit about that today, her background, and our journey together. And I hope you enjoy it. So, how are you doing today, Amanda?
I'm good, Trent. How are you?
I'm good.
Good.
I think. So far, so good. I'm alive. I'm breathing. So that's a good thing every day.
Mm-hmm. We're here.
So I got you on today. You are special to me. We went through quite a bit and had a lot of time to talk. We did really. So I'm excited to have you here. It's an honor.
Thank you. I'm glad to be here.
So for the people that don't know you, can you kind of give us a little bit of your background and I guess some of the things you've done prior to being a physical therapist, and then the education it took to get to the point you're at in your certifications?
Yeah, sure. So I've been a physical therapist for about 5 years now, and have been in the day nurse setting for almost that entire time. And I got into it shortly after just kind of working with my mom through some of her health things that she had going on, and seeing how therapy played a role in her recovery, and not just her ability to heal, but her ability to regain her independence, to get back to what she wanted to be doing. And I thought, man, I think I could do that, you know, and I think I could do it really well. And so I'm actually really a third career. I returned to PT school at that time, returned to school to become a PT. Before that, I was a high school chemistry teacher for a few years. Very different, right? Yeah. But also very similar in some ways.
I'm imagining.
Yes.
Yeah.
So that was for a few years I did that. And before that, I was a lab analyst. And so in those very different jobs that I had, I feel like I gained some different transferable skills that really, I think God prepared me to be the therapist that I could be whenever I walked out of PT school and started in the day neuro setting. So ever since PT school and discovering neuro PT, that's been where I wanted to be. That's where I've been most passionate about working. And I'm just grateful that God led me to a setting like day neuro where we really have the capacity to get to know our patients to a greater extent than you really do in any other setting, and dig into what their goals are, and what they're hoping their life is going to look like after this life-changing event they've been through. So
Absolutely.
Yeah, it's been exciting.
Yeah, exciting, and I would imagine fulfilling from everyone I've talked to so far.
Yeah.
So I got a list of questions today we go through.
Sure.
I want to kind of keep going on that, but we're going to circle back to that because I do have some more questions concerning that. But I guess, do you remember when we first met in my recovery process, and if there was anything that stuck out about my case among others?
Yeah, I mean, so, I feel like you, Trent, were one of the people who come in that, from the outside looking in, you're doing pretty well physically. I know there were some things you were working on. I feel like at the time you started, you were having more vision issues. I know the swallowing and the speech, and some of the cognitive training that you were doing seemed like bigger issues that you were working on. But you also, you live out here on this farm. You have a lot of physical things you have to do, and so we knew you were trying to get to a higher level of physical ability than it probably looked like just walking in. But I also felt like you walked in coming from the inpatient rehab with, a good grasp on what you were doing and why you were here. But I think like a lot of people, when you walk into day neuro, you don't know, it's a different animal. And
completely.
Yeah. And you don't really quite grasp how we're going to dig in, and find, you may look good, but we're going to find what's what's missing, what deficits you have going on that you really want to work on. And and I feel like you quickly bought into that game well.
Yeah. Well, I tried to, I've always been, for me, it was a challenge presented. Having the stroke didn't change that. It's all been a challenge. It's still a challenge daily. So for me, not that I would wish this on my worst enemy. I say that a whole lot, but it's been a challenge and I've grown a lot through it. I think it's kind of funny. I was talking to Jeremy the other day up there and noticed that he kept looking down at my feet. And I was like, man, don't be theraping me right now. I'm just standing there. Am I walking funny? Am I standing funny? But I'm sure that for y'all, and he was actually looking at my shoes because they were really dirty. Oh, so I'm sure you notice that too. But do you find that it's kind of, I don't know, that you do that outside of work
for
as
sure.
well? It's probably hard. And a lot of people have deficits they don't even know, right? Even somebody that's not been through trauma.
Yeah, we'll do it to each other. I was talking to Cassie the other day and she stopped me and she was like, let me look at your eyes. And then I'm like, what's wrong with my eyes?
Whoa, hold on a second.
And at the time, one of my eyes was dilated more than the other. And I think it was just sinus pressure because it cleared up. But we're just constantly like evaluating. Yeah. And it's hard it's hard to disengage from that mode in general, but
I can imagine, especially with the people probably you love, the most. Of course, you love the people you work with because you're with them all the time. They're like family. And then you get home and you're probably doing it to your husband as well.
Yeah.
To Lane. You're like, hey, Lane, how you feeling today,
What's
buddy?
going on with your knee?
Yeah.
He's like, nothing. No, there was a time we were driving through on my way to my parents' neighborhood. And this is kind of a deserted road and you don't see walkers on it. And there was a guy walking down the road and we're both kind of looking at him, with that, scrutinizing eye. And Lane goes, that's weird. And I was like, yeah, I wonder what's going on with his hip. You see how he's dropping his leg? And I was like going into his gait. And Lane was like, no, it's weird that he's walking on this street. And I was like, that too. But he really should probably see an orthopedic.
Yeah, I'm sure it's hard to step out of that mode.
Like gait mode, yep. For sure.
That's cool though. So I guess actually we're about to go right back in it. This is one of the questions, and you were talking about your kind of your history there. Yeah, is what originally motivated you to go into physical therapy, which you said was your mother.
Yes,
and then I guess even more specifically to go into neurological.
Yeah, it's funny. Whenever I worked as a lab analyst, I liked the job. But it was, in some ways, over time, it became rather monotonous. It was very isolating. I spent a lot of time in a room with a microscope or some evidence by myself. And over time, it just, we had talked earlier, it felt like not so fulfilling, And so whenever I transitioned to teaching, my plan was to reevaluate. Like, maybe I wanted to keep teaching, but maybe I wanted to go into healthcare. I just wasn't even sure what all was even out there. And that just happened to run concurrently with some just health issues that my mom was dealing with. And for her, she had a lot of things happening that were very difficult for doctors to diagnose. She went to a lot of different specialists. They would identify some part of the problem and it may have required a surgery, or they would try some medication, but no single doctor could really pinpoint exactly what was going on with her. And that was really frustrating for me as a family member. And I came to realize that that's not that uncommon, that people go through medical challenges that aren't immediately apparent to a doctor what it is, and there's a lot of testing that can be done, but a lot of conditions that people will have are eventually diagnosed by elimination. They have a certain presentation. We have to see how it progresses. There's not really a test to say it's this, but there's a test to say it's not this. And so you spend a lot of time of just not understanding what's wrong.
This is probably doesn't always get taken very well, but I always say, well, just throw some parts at it. It's like a mechanic. I know it's way more complicated than that, but I do kind of say it that way sometimes.
In some ways, it's not that much more complicated than that. It really, as much as we know about the human body, there's a world that we don't know. Right. And there's just a lot of uncertainty. But through all of that, she went to a physical therapist after one of her surgeries, just to recover from the surgery. And they did, they did some exercises that helped her with that. And then they also did some exercises that helped her with her balance. And in that immediate moment, I felt like we don't know what's happening, but in therapy, they can still help her. A therapist isn't diagnosing her either, but they can see like she has weakness in her hips. She has pain in her shoulder because of this mechanical issue. And then you can work on those things and make their day-to-day life better. So over time, you're still figuring out all these other things going on, but her life today is better because of the therapy she's been doing. And so I felt like, what a service that is. And the more I got into PT school and I discovered that's really common, especially in neurological conditions, that, you may not be able to fix what happened. There may not be a surgery that can repair what happened. There may not be a medication that can completely get rid of, nerve pain or fix sensation loss or do away with hypertonicity, but you can, through therapy, work through empowering that patient, facilitating that patient to retake whatever level of independence they're capable of regaining. You can help them work through their day-to-day and just celebrate the victories along the way and embrace what they're able to do now while they still have goals for what they want to do in the future.
Micro wins, I think, are huge and overlooked even.
Yeah.
What I feel like, and I hope you agree, is that what I already mentioned, that, we're talking about neurological conditions and treatments of that, but really as a culture and society ourselves, all of us can benefit from seeing the micro wins and appreciating those and, giving ourselves grace and understand that, not everything is going to happen tomorrow.
Right. Yes.
And I struggle that myself, I mean, I think everybody does, it's, especially if you're a driven person, you just get impatient and really they just said it the other day, everybody needs to learn a little patience in the micro wins. So it's really cool that you get to spend the amount of time. I think that's a difference in being a DPT and a doctorate, on that level of, being a physician or I'm not sure how the right wording on that, but you spend more time with the patient than most doctors actually can.
Right.
So, and I think that's part of the thing that makes it really hard for them to like your standard PCP to diagnose you. You're only going to see them every couple months, maybe. Yeah. They may see you more than that, but they're not walking alongside you day to day. So you see things as it progresses. You're seeing little things, that a lot of people don't notice.
Right. Yeah.
Right.
Yes, absolutely. Yeah. And, I think we are not physicians, physical therapists are not physicians, but we do have a doctorate level education, and we know our education provides a lot of knowledge on how the human body works at multiple levels, and to be able to see a patient and recognize if the impairments we're seeing make sense with their diagnosis, or if we need to have concern that there's something else going on. And then we can refer them to specialists or, make recommendations on how they should follow up.
Thank you for clarifying on that.
Yes.
Sure.
Yes.
No, I was trying to word that right, and I knew I was missing it somewhere.
No, that's okay. And that's, it's good to talk about like the difference between, a physical therapist and a physician. And there's a lot of doctorate level healthcare providers out there that aren't physicians.
Yeah, and as I've said many times here, I feel like what you'll do kind of gets overlooked quite a bit. There's a lot of other people that get the spotlight shined on them, but y'all are doing really important work. It was important to me, and my family, and I didn't even know. I had no idea what was going on up in that little building, you know?
Yeah, and that's true, and it's normal. I think that's pretty normal. You don't know what the therapy world does until you need it, or until somebody needs it.
Exactly. Yeah, and I think once you're there, then it's kind of hard to just ignore that anymore.
Oh, absolutely.
But
And you wish everybody knew about it.
Well, yeah, I wish everybody knew about it, and everybody eventually is going to need it. I mean, that's the thing that I was watching a deal that my buddy sent me this morning. I was just talking about aging. 50 is kind of like an awakening time, whether you have a medical condition or not, but having a medical condition really does. And you say, well, I'm over halfway through my span. Now I've had this thing, but when you're younger, you feel like you're invincible and don't pay as much mind to taking care of yourself like you should, and being aware of things that you're doing that are harmful to you. And we do walk in a toxic soup. So, without being over the top, there's a lot of things you can't avoid, but there's a lot of things you can
absolutely
help yourself. And golly, if I can get that point across to people, I do my best for the rest of my life trying to do so, because I definitely did not do that myself.
Yeah.
And then stress was a big part of mine, I think.
Yeah.
So,
for a lot of us.
So, let's jump to dry needling for a little bit. I do want to talk about that. I don't think a lot of people know much about dry needling. I definitely didn't. And a lot of people think of acupuncture when they think of dry needling, but we're not talking about the same thing. Yeah. So can you kind of explain what dry needling is? Just, I guess, layman's terms, or,
Yeah, sure. And I feel like it's been in the news lately with TJ Watt. He had his incident with, I think it was an athletic trainer for the Steelers, that they had an issue with the dry needling. So I think a lot of people maybe are wondering, like, what even is it?
Right.
Acupuncture has been around a whole lot longer, and people are more familiar in general that you're using needles to treat different, maladies or issues. I will not pretend to be an expert on acupuncture. I know that we use similar and even the same needles, but the targets of what you're doing are very different. And so dry needling it's using a solid needle. It's not hollow, and it's called dry because you're not injecting anything. And so it started decades ago. There were some physicians who were doing some research on if you could inject lidocaine directly into a muscle, would that help with muscle pain? And they observed that there was a mechanical response, a physiological response to just the presence of the needle before they even injected the medication. So being, smart and observant, they decided to try and see what happens if they just inject the needle without injecting the medication. And so they did some studies, and they found that people had as good of a response to just the presence of the needle in terms of managing pain in a muscle as they did using the lidocaine. So there was no improvement in the performance of the lidocaine versus just the needle. So from that, they developed dry needling as a treatment. It's mostly used by physical therapists here, but there are other professions that can also use dry needling. I think chiropractors, athletic trainers, some other like OTs, I think, can use it as well, depending on their state and their practice act. But we use it primarily in physical therapy for orthopedic conditions. So you're having an overused muscle that's tight and painful, and you can use dry needling to sort of reset that muscle and relax it.
And we're not talking about necessarily because it just from on the surface, it almost sounds like it's a placebo effect, but we're not talking about that. We're actually talking about a genuine reaction that the muscle is having.
Oh, yes. Yeah.
Or nerve. I don't know. You'd have to explain that a little more, but genuine reaction. It's not a placebo effect.
No. Yeah. To be clear, when we're talking about those studies, you do an injection with lidocaine, a needle with no lidocaine, or no treatment. Both the lidocaine and the needle have a positive effect, better than no treatment.
Right.
So, but the lidocaine was not more beneficial than the needle. So that's where dry needling started. Okay. Yes, for sure. There's a physiological response. Without getting too detailed and boring, there's a lot of theories on what is happening at the cellular level. But kind of the easiest way that I usually explain it to patients is if you think about when a muscle contracts, it's going to produce metabolic waste. And typically in a normal functioning muscle, that waste will be flushed out and then the muscle can relax. When you have a muscle that's either in overuse or is maybe being used at or progressing at too fast a rate for some type of contraction or functional activity, or maybe in the neuro case, they have hypertonicity, which is almost in a state of perpetual overuse. The muscles are producing this metabolic waste, and there's so much tension in that muscle, it can't be flushed out. And so whenever that happens, the enzymes that are normally used to stop a reaction are not able to work to the efficient level that they normally would.
Right.
So you end up with tension and pain in a muscle. A needle, just the presence of the needle is going to draw an immune response to that area, and it can help facilitate the removal of that metabolic waste and reset the muscle to allow it to relax. Mm-hmm. Yeah.
So, I mean, for instance, like if you were, and I do remember for me, I had a lot of things going on there, and that dry needling was super. I had other things that I feel like that helped with as well, that I want to talk about shortly. But, kind of like almost just layman's terms, like a cramp or whenever that muscle's super tight and you're going in there, and when you dry needle, it actually will allow that to relax and give it a minute and, let that buildup release. So for me, one thing that I felt like was a benefit, and it could have been in my mind, I don't know, I don't care, but I did not have any feeling on this side of my body. This from my midline over this way, no temperature control or anything, or be able to tell, if it was warm or cold. And as we were doing the dry needling, some of that did start coming back, and it stayed now and been better. I don't know. It was a strange thing when that happened. I remember telling you, but it was a benefit.
I was like, don't knock it.
No. I gladly took it as what it was.
Yeah. And that's also, I'll say this. I was very fortunate to work under a clinical instructor, Jennifer Zoll, who was one of the only people the only person I knew at that time that was using dry needling in the neuro population. It is traditionally used in sports and orthopedic. That's why like athletic trainers do it. Like athletes are often having muscle aches and pains, and dry needling was good for resetting that.
Right.
The neuro population wasn't really even aware of how it could affect their patients. And because of that, there is little to no research on the direct impact of dry needling on strictly neuro related deficits like increased tone, hypertonicity. But what she had the foresight to see is when you are a neuro patient, your body is not moving like the way it normally does. And you're going to have orthopedic conditions and orthopedic pain secondary to the change in your movement patterns.
Absolutely.
Exactly. And so she got her dry needling certification to be able to help people with sore traps from, compensating for weakness by using their shoulders up here, or soreness in their arms from using assisted devices,
right?
Postural pain from being in a slouched position or sitting in a wheelchair a lot. So she had that foresight, and I was able to see that and train under her. But there is indicators that dry needling is affecting even the motor plate at the cellular level. So we're talking about where the neuron is meeting the cell. There's some sort of neuromuscular reset, even if we don't have great understanding of it. And at the very least, we know the presence of the needle in that muscle is going to draw your brain's attention to that body part.
Right.
And that's a huge part of stroke, right?
It really is.
It's a huge part.
I say that a lot, and I learned that from y'all, but your body's going to follow what your brain wants. And if your brain's like, oh, hey, that part's still there.
Oh yeah.
Exactly. Hey, I'm supposed to be doing something with that.
Exactly. And so I do think that we, not from research, but just anecdotally, what we've seen by introducing needling to the neuro population is there are responses that we don't necessarily expect or explain, because at the very least, we're improving awareness of that body part to the brain.
Right. Yeah. And I think we were talking about it earlier. It's a good spot to kind of slide it in, was that, where AI is kind of going to lead with some things like that. The amount of calculations and things that it's able to do that would take many, many years, I think are going to progress some things like that we're still trying to, learn. Obviously, a lot of those things are just going to be trial and error, just like that. I mean, the same as me. I'm still gaining some temperature, but I remember specifically during the dry needling, all of a sudden feeling cool air on this part of my cheek. And that's kind of grown over time a little bit, but still for sure right here is probably where I have the most sensitivity to temperature, which is cool. I mean, and that I remember specifically that happening during the dry needling process. So, and, I think you're super talented at what you do.
Thank you.
When it comes to that specifically, other people may not have the same outcomes. Obviously, I think everything's unique to every patient.
Yeah.
Every person's body operates different. But I think the person actually doing that care matters, because I did go try somebody else. I'm not going to mention any names. Because I couldn't get with Jennifer just because of the distance, that I would have to travel to make that happen. But I did find somebody else to do it. But I ended up stopping because it just was not the same.
Yeah.
So,
and maybe that's something that just comes from just that neuro knowledge,
right.
Versus somebody who's typically dry needling for muscle aches and pains.
Well, that's a hat tip to you. I mean, I think you're very talented at that, everything you do, and that in particular. So I'm just kind of looking back over to see if there was anything else I did. Okay, well, here's a question kind of that we were already talking about it. But so when you evaluated me for the dry needling, what led you to believe that dry needling would be beneficial for me?
Well, so because you weren't directly on my team,
right.
Typically, was Sarah Beth or Maya your OT?
Maya.
A lot of times, because yours was more in the hand or the arm we were doing the needling in. So a lot of times it's the OT or the PT will just recognize some tone, some tension, pain as maybe a limiting factor in some of their treatments that they're doing. And so they'll ask me to just sort of take a look and see what I think. And that's really my main goal when I'm dry needling a patient is it's not going to fix or cure the muscle, but it can improve the symptoms to allow you to tolerate other tone modulating or weight bearing exercises that maybe were hard to tolerate before the needling.
Right.
And so I feel like that's where we were with you. You were having a lot of tension in your hand.
I'm a guitar player. So that was really wanting to move that, and that's something I still attest to on top of the dry needling was Rachel, and people see me doing this all the time, but Rachel just told me, she said, just start building that tick. She said, you may do it for the rest of your life. It's a habit, but I still, even now, this hand wants to be stiff, but I think at that point when you were working on it, I was really bound up pretty tight.
Yeah. I feel like I remember that. And that's the idea of, we can treat the pain and the tension that's probably a result of the tone. Like I said, if you think of high tone, it's almost putting your muscle in a perpetual state of overuse.
Thank you for describing that, because a lot of people don't know what tone is, and we really hadn't got to that yet in the podcast. So that helps.
Yeah, sure. So your body is always in some level of tension, right? Because if we were completely relaxed, we'd just be puddles on the floor, right?
That's a good way to put it. Yeah.
And so your body has like a base level of tone, muscle tone, in every muscle in your body, and that's going to change based on your posture or what you're trying to do, and your brain is going to regulate how you're going to, or how your muscles are going to change that tone. So do I need more tone to be able to actually contract, to lift something? Do I need less tone to allow another muscle to contract? And your brain is going to modulate that. Whenever you have a stroke, or a spinal cord injury, you're going to lose a little bit of that modulation. And so your body's sort of backup system is just clench. So that way you're not, a puddle.
Right.
So you're going to have more tone, and then your brain will downregulate that. In the event of a neurological event, you're going to have too much of that. And so then it's tension.
Right. And that's why you see more of what people in general, what they think of when they think of stroke, some of those symptoms with the hand and the arms and just things that naturally come with it.
Yeah.
That is tone, and that is the muscles just tightening up and not wanting to let go. And your body, and your body's trying to protect itself, I'm sure, at that point. Or your brain's trying to protect your body from something that's already gone. So,
and to be clear, like a needle is not going to completely relax that muscle.
Right.
It's mainly going to if you think of that tonic muscle or hypertonic muscle as having, it's in overuse. It's being used more than it's ever been used before. Right. The muscle is going to be painful, and there's going to be tightness and possibly even not a true contracture, but just a shortening of the muscle. Then the presence of the needle can help reset, improve the pain, allow a little bit of relaxation. And so then you can move in with what's the tried and true therapy methods for reducing tone. That's usually going to be a lot of weight bearing, pressure, and just honestly using the muscle and using the opposite muscles.
Yeah, and hopefully preventing the necessity of a surgery or something, because that's a lot of things. And something else that I didn't realize that I've learned along the way, that the longer that muscle's in contraction, and the longer that you keep it tight and you're not stretching it, it's fixed that way.
You can't. Yeah, your muscle will functionally shorten.
Yes, it will shorten. And if you don't do something to prevent that along the way, then you actually have to surgically fix that, possibly. So I would agree that for me, I could feel the release on that and see that dry needling can help. So so there's a phobia around needles.
Sure.
Obviously, a lot of people are really afraid of needles, and it's never really bothered me necessarily. And I can answer this question, but have people told you that it hurts? Is it a painful thing?
Yeah. And that's one thing whenever I'm educating a patient before we even start, I want to kind of tell them what to expect. Usually when the muscle, you'll feel the muscle go in, just a little needle. And these are, you've seen them. They're such a small grade needle that goes in, smaller than if you're getting your flu shot or something like that. And then when the needle enters the muscle, you'll feel like a deep pressure where the needle is. And it's almost like an ache. And I wouldn't call it necessarily painful, but it's also not super comfortable.
Right.
And then that sensation can travel up and down the muscle and along like the nerve, the path of that same nerve that is innervating that muscle.
Yeah, and you being aware of the body, I mean, we went through it, but there's sometimes when you're working down through that muscle and you're like, oh yeah, does that hurt? Or can you feel that up here?
Right.
You know? I'm thinking, oh yeah, that's kind of weird feeling.
Yeah.
You know?
Oh, yeah. You'll do the trap muscle, and it's common to feel it in the teeth and the jaw, or even it'll be a ram's horn pattern around their ear.
Yeah.
And so like making sure they know that, and they're not like, whoa, what's wrong?
Right. Yeah. And I'm sure everybody at first is a little bit tense in that situation anyway.
Sure.
So, and to be clear on that too, I mean, you know what it feels like because that was part of your training, correct?
Yes. Yeah. Yes. Every muscle I had needled on me.
That's right. So it's not like you're going and doing this to somebody and don't know exactly what they're experiencing. Yeah. So that's really neat. Thank you very much for your expertise in that and what you did. It did help me tremendously. And I hope, we can make that more popular and, get it out there, get the word out for people that don't know, because it is, y'all's facility in general, there's so many cutting edge and different new things that aren't available at all rehab centers and recovery rehabilitation areas.
We're definitely given some autonomy to use our clinical judgment to modify and trial some interventions to fit what we think that patient needs.
Yeah. And being around and visiting with more people like I am now, not all are created equal. You think, okay, we're just going to go to therapy. That's very important to get your loved one into a place that's, neuro certified helps a whole lot.
Sure. Yeah, sure.
Just regular therapy is not going to be exactly the same. But even more than that, research it and see what the success rate is of that, because I visit with people that have gone to other facilities, and I think it really boils down to the level of care that you get and some of the things that, just, they don't try at other places. I Nelson did hit with me and it was high intensity, and most people were afraid to kind of touch me there because I had that clot in my aortic arch, and Nelson said, I really think, he said, let's talk to your cardiologist. Like, I think he can probably manage it up to, I think it was 130 or
right, they'll give you a parameter.
And, he put weights on me and was dragging me from behind on a treadmill and really pushed the limits on that I don't think would just happen in any facility. And I think that's kind of the point I'm trying to make, is that y'all seem to go above and beyond and in a positive way to help patients that need it the most, and I think that if I hadn't had that start, with somebody like Nelson, it wasn't that was able to do that, and say, hey, look, this is probably going to work really well. And it did. And it's still to this day, I'm definitely have no credentials, but I know it's worked for me. And I do have a mental clarity. I feel better whenever I can get that heart rate kind of for an extended time, up there at 130, 140. And as I get better and time progresses, that I can raise that rate just a little bit more, push a little bit harder, sweat a little bit more. But when I have days that I'm down or really struggling, just a simple walk and getting that heart rate going changes my whole mental outlook on everything. So I think it's really important.
Yeah, that is really good.
I think this is a pretty good question to hear from your viewpoint. I think we've kind of went over some of it, but from your viewpoint, what makes stroke type therapy more challenging than others?
So, obviously I was drawn to this patient population. And I did not spend a lot of time treating in any other setting. But I can speak to, I feel like what often makes stroke or neuro rehab, a unique challenge is it's a life-changing event. I don't want to downplay, joint replacements or, back pain or shoulder pain that you see treated in an outpatient setting that requires a scrutinizing eye. It requires, a professional physical therapist to work through the unique nature of each individual patient's experience with that. But in a stroke treatment setting, your patients have had this life-changing event where their life has been turned upside down and they're dealing with multifaceted deficits and impairments. You're coming in and it may not just be, I don't walk as well as I did before, or my balance is not great. My coordination seems off. You may be dealing with, I can't speak well. I can't understand people who are speaking to me. My processing is slow. I can't keep up with conversations. I can't eat. I can't swallow. I look different. I see how I look different. I feel different. I experience emotions differently. I mean, it is a top to bottom, head to toe change for somebody who's had a stroke. And I think for the therapist, you have to have good recognition of what the patient is experiencing. And that's challenging for your therapist who's never had a stroke, right?
Right.
We have walked alongside people who've had strokes for a lot of years, but I don't know what it feels like to have hypertonicity in my arm or a flaccid arm. I don't know what it feels like to have a subluxed shoulder or to not be able to express the words that are in my mind, or to not be able to understand, my spouse whenever they're speaking to me, or my kids, to not be able to get on the floor and play with my kids. I don't know that experience. And so I feel like our challenge is to try to walk alongside you through that and recognize how those factors are affecting your ability to participate in any given task throughout the day, and still try to keep guiding you towards, what your goals are, and address those needs, collaborate with other professions who are addressing those needs, be available to have discussions with the patient about it, make recommendations if there's a recommendation to be made, or to just hear them,
Right. Because you do have to do that. And you do see so many hard things in the case of a day, and then sometimes months, of a person. You get to know them well. How do you compartmentalize what's a rough day when you get home and get back to your family and leave that part of your job there? I mean, how does that work? And that is a tough thing to answer, because you'll hear people talk about, professional and
life boundaries and work-life boundaries. And it is important, but we are whole people too,
Absolutely.
and I think I don't think I ever completely leave something at work. I think like sometimes I have my best ideas at about 3 a.m. in the morning.
Yeah.
I'll wake up and I'll have ideas for therapy on a patient, or I think for me, it's very helpful having a very supportive and also empathetic spouse. He's somebody that I can talk through things with. It helps having the coworkers that I have.
Mm-hmm.
We can talk it out, talk through things in, kind of a safe, judgment-free zone. Sometimes you just got to vent about some things that you're watching your patient have to go through that you wish you could make different. And then to be honest, I think it also goes the other way where we have life events that are happening, and how do we come to work and be the, positive, smiling, friendly, empathetic, there for you therapist for our patients. And that can be really hard too.
Yeah, because there's days that you don't want to go to work either, just like anybody. There's days that you're dealing with sick kiddos or a loss in your family or something that's heavy on your end, and you're going to go in and have to pour into people. And you're, even when I was talking to Cassie, when you come to work, sometimes probably empty.
Yeah.
You start off the day that way. That's got to be tough too.
Yeah. You hear that phrase, pouring out of an empty vessel. And so something, for me, that's super important. I know you and I have talked about it is faith, and so how it's not so much that we're compartmentalizing, or for me, that I'm compartmentalizing or setting aside, what's burdening my mind or my heart, either when I'm at work and I'm going home, or I'm at home and going to work. I rely very much on the Holy Spirit, to speak to me, to sit in my heart and help me be his hands and feet. Whenever I'm out when I'm at home working, not working, being with my family,
right,
or I'm at work working with patients. It's a reminder that our interactions that we're having with anybody can have a huge impact on them in their moment, as they go forward. And so relying on the Holy Spirit to speak through me rather than my own words, or for the Holy Spirit to help me see people through his eyes rather than my own eyes, to have him see myself through his eyes instead of my own eyes. That's essential. And I think for me, that's been more successful than putting it in a box and putting it away. Because if you do that, it's going to come back out. And sometimes it comes back out at the worst times,
Absolutely.
Yeah.
No. And faith's huge. And I couldn't have said that any better. I think I'm so glad you mentioned that, because there's a lot of people that are trying to walk through this life without that. And they have no idea what that's like to be able to go, I give it all, and I'm going to hand this to you, and let that be there at your feet, and hope that I am following what you're giving me to do, and moving forward in a way that's pleasing and honoring.
Yeah. And I think, and when I say this, I don't want to sound like I've mastered it or I'm an expert in it. It's definitely something that I struggle with on a daily basis, but I think it's important for us to even embrace our inadequacy. And I think, if you go back to, the Sermon on the Mount in Matthew, and the Beatitudes, and just recognizing like you are blessed when you realize you're broken.
Oh yeah.
And so to be almost grateful, not almost, to be grateful for your weakness, because that's where his strength shines. Then I think that you can defeat those inadequacy demons that tell you you're not good enough. You're not good enough when you say like, well, I'm not by myself. But I'm not by myself, and whenever I have, whenever I'm walking a path of obedience and I'm serving as his hands and feet, then he will provide, he will make me adequate for the service that he wants me to provide.
I love that.
Yeah.
Yeah. And I'm sure you're probably constantly under attack from all directions. I
think that's true too.
Yeah. Well,
and you can't fight them off yourself.
You handle it well. And man, we spent quite a bit of time together during those sessions, always had good conversations, and it seemed like you always handled yourself very well and very professionally. I've said that many times. It's one thing that I just feel like you shines through very well, and you do have a lot about you. So I appreciate that. So we're kind of, I knew that we would be able to, we really could probably go easily another hour. We may have to do another session, but I do want to touch on this really quick before we start to wrap it up. And it's the current events. We've discussed it a little bit, but current events surrounding education and what the changes going in that, but one thing I'm seeing personally, or the way I feel about it, not being a healthcare professional, just somebody that is around it quite a bit now, is to me it's really kind of disrespectful to the craft and to the trade and the time that you have invested in what you do. Yeah. Also bounces back to what we were saying earlier, that people don't really overlook it until they need it. And then when they need it, then they realize, man, this is such an important thing. So that all being said, what is the current climate now? What are they trying to do? And how is that going to affect the future of
Yeah, I feel like it's definitely a complicated issue. But I feel like this was November or so, whenever it was released that at the federal level there was a list of professional degrees, and they're going to be making recommendations that there is a cap on what the federal government will approved for student loans for different degrees. And if you weren't on this list of 10 professional degrees, then you were going to be at a lower level. And when I read into it, the amount that they were talking about for the non-professional degrees, if you follow that terminology, it's going to be difficult for schools to function at the level they're functioning now, and students to be able to borrow solely from the federal government. And I'm not entirely sure all the motivating factors or all the determining factors that made this list of 10 professions. And make sure I say the ones that are on there, I don't think there's anything wrong with those being listed. It's more the professions that were excluded, which includes all therapy, occupational therapy, physical therapy, speech, language pathology were left off the list. Nursing was left off the list, which I think was the primary one that was being highlighted in the media. And counseling, any kind of counseling was left off the list. And I feel like kind of what was put out there was, well, the cost of their education does not match what they earn later on. And that's not necessarily wrong. I don't think that those professions are maybe paid at the same level as what I think they should be for the services that they provide, which we could get into a whole nother conversation about reimbursement and, Medicare leading the right way with all of that. But all that being said,
and I do think maybe we do have another visit further because you and I have discussed insurances and all these different things.
We could go down a whole hour probably of that conversation.
But carry on. I'm sorry,
sure.
I didn't mean to interrupt.
No, you're fine. So if we're the reasoning for doing this, for capping what the federal government is willing to loan students to be able to complete these programs, if it's limited, what I think you're going to see is fewer people following down that path. Fewer people who are able to pursue physical therapy or other professions that were left off that list. And I feel like we're already dealing with a shortage of healthcare workers.
Yeah, it's a little bit frightening just to think about that, because if we are dealing with a shortage of healthcare workers. And without saying any names, somebody that I know that was planning on going, and I can't think of the name of the actual but they were going to be doing the ultrasounds and stuff like that. So, but opted for a different degree because of just the amount of time that it takes to get that done. And I guess, a level of difficulty, but it does have to do with our current culture and this immediate gratification that younger generation just wants to be able to get out there and hurry up and make some money.
Right.
But, the fewer people that are going for those degrees, we already have a medical crisis in this country as far as I'm concerned anyways. Yeah. And then if you're going to start pulling even more away from that drawing more from that pool, I guess is what I'm trying to say, of people that are able to do that job, then where does that leave us?
Right. And I, if you look on the Department of Education's website, or if you contact your congressman and they reply to you, which I did, you're going to get some boilerplate explanation of, well, for one, the terminology of professional degree was an internal phrase, and it's not any indication on whether we think you're professional or not. I'm like, well, then maybe use a different language, because it is insulting. And two, they feel like student loans are out of control and universities are charging too much. And so by capping it, they're going to force universities to bring their tuition down. And to me, why not directly just either cap what tuition can be, or maybe require universities to provide, their budgeting of why they charge what they do, rather than cap student loans. Because when you cap student loans, all it's going to do is create an industry for private loans.
Correct. Well, yes. So, I mean, there's already, and I personally have no problem with privatization of things. I think that does push things to a better place. But I agree with you. They have full control, and the IRS loves to look into everybody's business. Well, let's look into their business. So I'm with that 100%. You know, why is it so expensive to go to school? We're supposed to be one of the biggest, most powerful countries in the world, and we're failing in one of the most important things, which is our health and education, both. We're just. It's
a remarkable gap between how much knowledge and research and just advancement in medicine and science we have as a country, and our population does not have access to that. Right. They're not receiving it, and for mostly financial reasons. And when it comes back to this list of 10 professions, I don't really understand why some of these professions are on this list and others are not. When you look at the content of what's even in their program, I believe one of them is theologians, and we're talking about faith. Obviously, I'm very pro theologian, and I'm great with them being included as a professional degree. But I'm wondering, where is the cost that they were requiring more funding to get a degree in theology versus a physical therapy program that's going to include things like cadaver labs that have to be maintained, expensive equipment, simulation labs, clinical relations. Like there's a lot that goes into a quality physical therapy program that can back up the reason why it costs. And some of those programs are able to be within a healthcare system, like a health science center. So they're sharing these resources with PA and OT and DO or MD. So they're able to split those costs, but other programs can't. So you are going to have some programs that cost more. Sorry, I keep hitting your microphone. You're going to have some programs that cost more than others. But to me, if the schools can justify that, why are we putting those limits? Right. Yeah.
Yeah, well, and, obviously somebody's padding their pockets in that deal for that to be even an issue or for something that's being discussed,
Right. Yeah.
Somebody's patting somebody on the back saying, yeah, we ain't going to take it out of our pockets, but you could do it here. Yeah. And it's just that it's really a scary thought to put any more impingement on people that are wanting to go out and help others. You know, I mean, that's what that field is, that you take an oath to help others when you do that.
And it's just driving disparity.
And nursing is no joke. The schooling for that, I got a couple friends that are nurses, is not like you just go in and you're going to go get that done. I mean, to get the full blown, I'm sure even what y'all do. I mean, to really get to that point, there's a lot of work, a lot of effort has to be put into that.
Absolutely.
So, man, well, I guess that kind of goes over that in a short amount of time.
Yes.
Because we could probably spend a whole episode just talking about that whole situation.
And the best we can do at this point with it is just advocate for ourselves. Our professional organizations are advocating for us, but I mean, even anybody who's listening to this, you have, somebody who's in healthcare, you work in healthcare, or you just, recognize that healthcare is important. Contact your congressman. I think that's the best thing I can say to anybody is that if they can get enough of a volume of people who want to make it clear that healthcare and therapy within healthcare, from my perspective, is important,
right,
and should be, a right to the citizens of the U.S., then hopefully they'll recognize that and make adjustments to these recommendations.
Yeah, and with technology like it is now, there's really no excuse. It does seem a little bit daunting if you've never done it before, but contacting your congressman is really not that hard, or congressman or woman. It's fairly easy. In our case here in Texas, they're actually, you can get a hold of them a little bit easier. I think I'm kind of proud of that for most part, but they're still signing some bills in, and they're up there under the same pressure, and they're part of whatever. And this is not a left or right issue. You and I
they
both
just need to hear
about
from
it
us.
As well.
Yeah,
that's right.
Yeah.
And that's not a left or right issue. This is an all the way around issue. This is, no matter how they want to spin this thing, that really doesn't matter. We're talking about people's health. Doesn't matter what part of, or how you believe, or what part of life you're running through.
Yeah. And I would just add to that, like, if you are somebody who would like to contact a congressman about these issues and you aren't sure what to say or how to say it, you could pick any of these professions that have been left off and go to their national professional organization's website and look at their current issues. And there's probably going to be a blanket email that they're requesting that people send. So like for physical therapy, it's the apta.org.
apta.org. Okay.
Yeah. And if you look in their current issues tab, there's going to be something about this topic and what you can do about it.
Yeah, I mean, since you're the guest today and guest of honor, in my opinion, we'll stick with the APTA, and I will actually put that down in the link below, and I will also probably add that to this part of the conversation.
Great.
Thank you for sharing that.
Yeah.
And I think that's super important. So they can go to apta.org and actually get some of the talking points and things that are being discussed right now, and have a little bit of ammo when they go and say, hey, this is how I feel about this.
And it's a united front.
Yeah, that's
We're all talking about the same thing.
No, and pretty much everybody has somebody in their family that needs therapy or that is currently going through therapy. I mean, it's just I think it's golly, it's so important.
Yes.
It's so very important. Right. So I think we kind of went over that, and I think we're getting close to kind of wrapping it up. Like I said, you and I probably could visit for the rest of the day on this, but I don't know if we keep everybody's attention. So just look here and see what else I got left. I know exactly where we'll go.
Okay.
So, do you have any words of wisdom or anything that you feel like is important to tell others on their journey, either through recovery or a loved one that they have or life in general? Just some words of wisdom from Amanda.
Yeah, so I giggled at that because that's in our graduations. For all of our patients when they're leaving day neuro, we always ask them, what are your words of wisdom? Yeah. So you're flipping the script on me and asking me that question. I think we might have talked about it earlier. It might have just been you and I separately. The biggest thing is, if you're a believer, recognize that you are called to be his hands and feet in all circumstances. And so whether that be you're a patient in therapy, how can you still serve as his hands and feet? And that's something I think I saw you do well. Mm-hmm. And I feel like that was kind of a transition point for you, is whenever I feel like you started to recognize that role that you served. Mm-hmm. Whatever your circumstances and whatever your abilities or disabilities on a given day, God has air in your lungs and a purpose for you.
Absolutely.
And so that may be sitting next to another patient and being an encourager Just showing them how you're working to put in the work to make whatever recovery you can, celebrating those micro wins, like you said, learning to find joy in the day while you still have goals for your future. I think being an example to others in that way is a good way to serve his purpose for you. And you do the same thing for your therapist too, whenever you have that kind of attitude. And then I think you've also exemplified that in how when you left those doors, you started this Broken Road project, and you're paying forward anything that any of us ever poured into you, So whether you are a patient or you are somebody who works in therapy, or you're a caregiver, a family member, a friend, just looking for ways that you can serve his purposes. That may be very practical things. It may be offering people rides. It may be meal trains, but maybe something as simple as hopping over and helping with some chores, or, putting up or taking down Christmas lights, this time of year, things that will help the people who are going through this resume some sense of normalcy and recognize that they're part of a community who cares about them. And when they see you serving that purpose, it'll help them recognize that they still have purpose.
Absolutely. Yeah. And then we could just build what I hope is a culture around that of, more people helping others, and doing what we're supposed to do. Yeah. I mean, that's what that's what we were created for. Yeah. My true belief is to lift each other up, love each other, and be a light, be his light. Yeah. So that's cool.
That's the way to do it. I mean, we sit here and we talk about frustrations with insurance and government choices and decisions, but ultimately, we do not rely on a government or a politician or an insurance company. We rely on a good, sovereign, faithful God. Amen. Who has done good things for us through the history of time. And we've known it, we've seen it, we live it now, and he will continue to fulfill those promises in the future. And sometimes the way that he carries out that provision, most of the time, the way he carries out the provision is through people. People are his provision. There are people in my life who are his provision for me. I hope that I am his provision for other people. And I know that you are serving in that way too.
Thank you. I hope so. I'm trying.
Yeah, I believe it.
Well, I appreciate you coming on today. It was definitely my pleasure. And I hope everybody gets something out of this today. Please subscribe, like, share, get the word out. And I appreciate you tuning in. I'll see you next time.
Thank you.
I'll do my best one day at a time on the broken road, on a broken road.